Hello, my dear friends. Today we'll be talking about a new product of the Denas group of companies, the modified Denas-Osteo device. The previous version of the Denas-Osteo device is well known among our customers as the device for treatment of issues of the cervical spine and the shoulder girdle. With the coming of the new version, the possibilities for using electroneurostimulation to treat patients with pathologies in those regions have been greatly widened. But let's begin from the start. Why focus on the neck? The neck is the most flexible part of the spine. That's why in upright posture, our neck is constantly subjected to significant loads, supporting our head. Neck problems were well known even to healers of antiquity. But in our age, because of the modern lifestyle, these problems start manifesting earlier and are more acute. Among the risk factors for cervical spine disorders, as well as those of muscles and ligaments of the neck, are sedentary lifestyle, especially when the head is in a static position, for instance when working with a computer or driving a car. Then there are injuries, frigorism, the habit of holding the phone with the shoulder, and other factors. Clinical signs of neck pathologies are diverse. This could be localized pain in the neck or shoulder girdle, headache, dizziness, feeling of numbness in hands, vision and hearing disorders, buzzing in ears. Also, patients lose their working performance, the ability to concentrate goes down, and they get tired more easily. Among various treatments of degenerative neck pathologies, physiotherapeutic methods occupy one of the leading positions. One of those methods is dynamic electroneurostimulation. The new version of the Denas-Osteo device has retained all the capabilities of its predecessor. I'm talking about the pain treatment and relaxation operating modes. Let me remind you that the pain treatment mode is designed to bring relief from acute and intense pain in the neck and shoulder girdle. Specially chosen frequencies, together with alternating electrodes mode, imitating electromassage effects, bring fast and guaranteed relief from acute neck pain. The relaxation working mode is designed to relax muscles and to deal with neck fatigue, such as resulting from prolonged static loads, when there's no acute and specific pain. Also, the relaxation mode is ideally suited for prolonged treatment courses of chronic cervical spine disorders. Furthermore, this mode yields good results in treating the neck as a segmental zone in treating disorders of the head, neck, and hands. Let's talk in more detail about the new version of the Denas-Osteo device. It has two new automatic programs. The first program is called Headache. It was not by chance that we chose this mode. Headache is one of the most common pain syndromes ever. More than 120 disorders can cause headache. Among this variety, the problems of the neck occupy leading positions. In the course of multiple experiments, we have chosen frequencies and their combinations, which prove to be the most effective in helping patients suffering from headache. Our clinical trials had confirmed our findings. Patients suffering from headache now have a new, drug-free method of solving their problems. The second mode that we've added to our Denas-Osteo device is called meteosensitivity. Many of us have experienced meteosensitivity issues before, when upon changing of the weather we feel headache, heaviness in the head, suffer from sleep and concentration disorders, melancholy or even depression, and general fatigue. Such symptoms can also be triggered by change of time and climate zones while traveling. Specialists from our medical department, together with design engineers from the production department of the Denas group of companies, have developed and clinically tested special frequency modes for stimulating the neck with the aim of solving the meteosensitivity issue. On the outside, the Denas-Osteo device hasn't undergone any significant changes. Only the design of the keyboard has changed, and the interface of the control box display became more intuitive. Let me demonstrate how to fixate the Denas-Osteo device with the help of our usual assistant. Using special pillows, the device must be applied to the most troublesome part of the neck and fixated using the cuff. Then you should turn the device on, choose the program you need with the mode button, number 1, 2, 3, or 4. Then, using plus and minus buttons, set the intensity of stimulation, and the chosen automated program will begin. In case of severe and obstinate disorders, it is recommended to combine and alternate different programs in the course of one procedure. Hippocrates said that a good doctor is the one who does less harm. In the Denas group of companies, we set ourselves an even more ambitious goal: to do our customers as much good as possible. I have no doubts that the new Denas-Osteo device, with its new operation programs, will help people suffering from headache and pain in the neck and shoulder girdle to solve their problems more effectively. As usual, I wish you health and all the best.